This is Patrick. I'm with Dr. John Viviano at his dental sleep disorder research and training center. Dr. Viviano has trained hundreds of physicians and dentists about how to treat sleep disorders, as well as have treated thousands of patients with sleep disorders. So we're going to interview Dr. John Viviano for some of his wisdoms. Hopefully that will be helpful to you guys. So Dr. Viviano, what can you tell us something about what you do? What you do? You treat patients and treat doctors.
Well, I'm involved in managing sleep disordered breathing, which is managing when the airway closes down during sleep, and snoring is often involved in this. And we do this through oral appliances. The appliances hold the jaw a little bit forward, help to keep the airway open, help to keep the tissues taut so they don't snore. There's no vibration causing the snoring. And of course, there's a medical necessity to keep the airway open because we need to breathe at night.
Mm-hmm. Yeah. Now, I was wondering what made you decide to dedicate your professional life to sleep disorders? I mean, you're a leading doctor in the field, and you could have, selected any other field to be the leading doctor in this field as well. But what made this sleep
Well, this is a relatively young area, dental sleep medicine.
Yeah.
About 1990 is when it came to be. I discovered it in the mid-90s, and at that time, when I first discovered it, I was just amazed that we could have, as a dentist, that much impact on the quality of life of a patient, along with, of course, impacting on the longevity of life. I mean, everything else we do in dentistry is great, and of course, giving someone a beautiful smile, a healthy smile, gives them self-esteem and helps in many ways. But I was really taken with how much of an impact we could have on a patient's life by helping them sleep better. And so much has come through the literature over the last 25 years, and we have such a greater appreciation now of exactly how important sleep is and how to perform optimally. We really need to be sleeping optimally.
Right, yeah. The right to sleep is so, of course, the dental health is very important, but as a good sleep is just so much, perhaps more important.
Well, it's going to impact on your quality of life and longevity of life to a greater degree, for sure.
Yeah, certainly. Yeah. So, what, as a leading doctor in the sleep disorder, field, what wisdom would you like to share with our viewers who may have some of the sleep disorder issues?
Well, of course, I have a platform here to talk about oral appliances, which is what I'm all about. Let me just explain that the gold standard treatment for sleep apnea and sleep disordered breathing is CPAP. Now, CPAP works 100% of the time, or 99% of the time. It'll reduce the apnea to the normal range. The issue with CPAP is compliance, and there's many patients that cannot comply with wearing it all night long. In fact, only about a third of patients wear their CPAP all night long. So for the next third that wear it part of the night and take it off, and for the last third that can't comply with wearing it at all, they're either being suboptimally managed or not managed at all. And unfortunately, if they're not told that there's an alternative, there's an appliance that can help many of these people, and they end up falling through the cracks and doing nothing. And so this is my message today, basically, is that if you're having trouble with your CPAP, or you know someone that's having trouble with their CPAP, let them know that there's oral appliance therapy available. It's literature validated, there's guidelines on it, it's supported by the medical American Academy of Sleep Medicine guidelines, and it works. Of course, there's a success rate associated with it for higher levels of apnea, but at lower levels of apnea, it works as well as CPAP does. And if the level that it's going to work at is a concern, we now have tests where we can test before we even make an appliance to see if the appliance will work before fabricating a custom-made appliance.
Mhm.
So it's definitely an alternative you want to consider.
Certainly, it is a lot more comfortable than the CPAP.
Well, long-term compliance with oral appliances
Yeah.
is 90%.
Wow.
And the reason is that patients find it convenient and
Right.
comfortable to use
Mhm.
relative to CPAP. Of course, you'd be better off not wearing anything at all. That would be first choice. But if there's an airway issue that can't be managed any other way, these are the most conservative methods that we have to manage them.
Yeah, yeah. So the sleep medicine is a very, very broad professional field, and there are many different kinds of sleep disorders. Dr. Viviano is mainly focused on the sleep apnea issues. So that is why we're talking about the CPAP machines and dental devices. And so, Dr. Viviano, you also were using the positional therapy. So what is a positional therapy? Why do you use it?
Well, for a subset of patients, their apnea is much worse when they sleep on their back in supine position.
Mm.
So if the appliance is not able to manage that apnea completely, then we use as an adjunctive therapy along with wearing the appliance, a positional therapy aid, something that will help to train them to stay off their back. And there's many different types available out there. Most of them revolve around being a pillow that's strapped to the back so that you can't comfortably sleep on your back. And there's of course these vibratory devices that have come to be, and the Ajuvia here that Patrick is all about is a very small and light and convenient little device, and I'm very much looking forward to working with it over the next little while and getting to know it better.
Yeah, how important is it to sleep in the right position? You were talking about the sleep apnea perspective, you were talking about the snoring perspective, you were also showed me something.
Well, there's recent research that's been published that indicates that if you spend too much time on your back, it actually leads to a neurodegenerative disease. And so further research is needed there, and we're going to learn more about that as we go. But it seems to be not a healthy position to sleep in, and a lot of people sleep on their back.
That's true. That's true.
So we know it's not healthy for your airway, for many people, and then there's going to be those people that their airway doesn't suffer at all when they sleep on their back. And it seems to also lead to other medical issues, once again, for a subset of people.
Mm-hmm. Yeah. And what kind of solutions are out there for the positional therapy?
Well, they have little belts that you wear that are the equivalent of having a pillow strapped to your back. There's special beds that have contours in them that encourage you to sleep on your side. Yes. And there's the vibratory devices. There's a couple of them on the market. The Ajuvia is a new one to me, and it is the smallest out of the different vibratory devices, which vibrate when you're on your back. So that is your cue to move over to your side. And it's really meant to be a trainer, just like the other devices. They're meant to be trainers. You wear them for a period of time, and eventually you develop new habits, and the habit of sleeping on your side versus sleeping on your back, and then you no longer need to be using these devices.
Now, based on literature, about 90% of the sleep apnea, especially the obstructive sleep apnea cases, remain undiagnosed. So basically means I may have obstructive sleep apnea, but I simply don't know that I do have it. So how can people like me know about it without going through this big and expensive sleep studies? Well,
depending on your region, sleep studies are usually covered by insurance on some level. The only way you can obtain a diagnosis for sleep apnea is with an official sleep study. That's the only way. Questionnaires will only get you part of the way there and will be suggestive of something going on. But you need to have a sleep study. And sleep studies can be done in a clinic, in the hospital, or even at home. There's at-home sleep study devices and systems in place so you can do the sleep study in the comfort of your own bed. But without that diagnostic test, no physician can really sign off that you have or don't have sleep apnea in particular. Yeah.
But going through those sleep studies, it is very expensive. I have to make the appointment. I have to go through quite a few hoops. Now, for the people like the general population, if they do not have that effort or time or money available to take that sleep study, but on the other hand, also sort of have a hunch, I may have this sleep apnea issue. Then what should they do? How could they sleep a little better?
Okay, so if we're looking about sleeping better, one thing you could try, of course, is a positional aid, to staying off your back and seeing if that improves things. Oftentimes people that have positional sleep apnea intuitively learn to sleep on their sides versus their back, and because they actually get a better sleep. So they've discovered that themselves. And for other people, they sleep 100% of the time on their back, even though their airway is mostly compromised there. So if your sleep is compromised, the first thing I would try, of course, is just finding a way to stay off your back and seeing how much it improves. But I have to say that with a caveat, because you could be turning yourself into somebody that still has a problem, but it's less of a problem. So you never really know whether you've resolved the problem completely unless there's a proper diagnosis, and that would require a sleep test. So if you're looking to improve things, a positional aid may improve things, Patrick. But if you're looking for the definitive answer, you really want to make sure you've corrected. First of all, you want to make sure there's a problem, and then that you've corrected the problem, you really need to undergo a sleep test.
Okay, good. So before we end this interview, is there anything else that you want to share? Any other wisdom you want to share with our viewers about how to get the better sleep, how to beat the sleep apnea, or anything else?
Well, in general, sleep impacts on every aspect of your being, and of course impacts tremendously on the quality of your daytime hours and your overall health. So it's a worthwhile effort to try and improve your quality of sleep. There's things like sleep hygiene, ensuring that your room is comfortable and not full of light, and staying away from these blue screens that we have on our devices, close to bedtime, and avoiding meals, close to bedtime, and staying off your back or minimizing time on your back, and not eating meals close to bed, and things like this that will help improve your overall quality of sleep. But if you're having an airway issue where your airway is closing down, then you really need to have that investigated, and you need to have some type of appropriate therapy to manage that.
Yeah. Now, I just almost forgot about this. I see this Ajuvia sleep device, and I see these binders.
Right.
So you are going to do some clinical studies for the Ajuvia sleep. This is a vibratory sleep position training device. So what made you decide to do this clinical study? You're very very busy, and
Well, when I saw the Ajuvia, I was most impressed with how small and light and sleek it was. I actually saw your YouTube video on it, and I thought, wow, this is really interesting, because as a clinician that manages sleep disordered breathing with oral appliances, a certain percentage of the time we have patients managed, but not 100%, maybe 80%, maybe 90%, maybe 75%, and we still have some residual apnea on their back. So having an aid that is like so small and convenient like this to use would be very welcomed in my practice. And so that's why welcomed the opportunity to do a little clinical trial. What we're going to be doing is we're going to be, for patients that are in that situation where they're wearing an appliance but they still have residual supine apnea, we're going to be conducting a trial with this and see if it actually trains them to stay off their back after a period of time. And then for those patients that decide that they're not going to go ahead with an appliance but they have positional apnea, we're going to be making it available to them also to see if it helps them. And in the end, what we're trying to see is does it keep them off their back? And do they eventually stay off their back without wearing the device? I think those are two very valuable pieces of information, and I'm very excited to be involved in this.
Thank you. Now, I noticed there's these beautiful models. These are probably would also be of interest to our viewers. Could you please explain a little bit about these?
So these are the mandibular advancement devices. This is the Sonident dorsal device, the Dream Tap, the DSAD, the Micro 2, and the Silent Night, and the Emma. These are just a variety of different appliances that hold the jaw forward during the evening, helping to maintain the airway open and patent, and putting tension on the tissues so they don't vibrate so much and reduce snoring. So the effectiveness for snoring is very good. 95% of the time, at least, we'll be able to manage the snoring. And the effectiveness for apnea, if you're talking about mild sleep apnea, it's equally effective as CPAP. If you're talking about moderate sleep apnea, about 75% of the time, the appliance will take you down to the normal range. About 25% of the time, you'll get improvement, but won't make it all the way down. And then, for severe level of apnea, over 30 events per hour, then it's about 50% of the time you'll get all the way down. So for those patients, the people that don't make it all the way down, then the appliance really is the beginning of the journey to wellness. And then they could use positional therapy or weight loss or other approaches to help take them the rest of the way.
Now, I hope this question is not going too deep. Now, if a patient is interested in using this dental devices, and you mentioned about it's a different kind, how do they decide which one is?
Well, really, the clinician decides.
Oh, okay.
They all have different advancement mechanisms.
Okay.
So the appliance should be matched to the patient. The patient has a set of teeth. They're going to have weaker teeth, stronger teeth. They're going to have grinding and bruxing habits, and they're going to have a small mouth, a large mouth. And depending on the patient and depending on what the sleep study shows us, if there's a lot of positional apnea, for instance, then you'd use a particular device over another. So it's not a matter of picking the prettiest device, it's a matter of picking the device that's most appropriate for that particular patient.
Okay, so the patient, if I come to your clinic, I'll say I have this issue, and then you look at my situation and decide, okay, this one is the
Correct,
right one.
yes.
Okay.
Yeah.
All right, okay, good. Wonderful, thank you. So I'm with Dr. John Viviano, who has been treating sleep disorders for over 25 years. He has trained thousands of sleep disordered patients and have trained hundreds of physicians and dentists who are learning how to treat the sleep disorders. So thank you.
Thank you, Patrick. It's been a pleasure.
Thank you.